Hello, this is Dr. Joe Gary from Mosa Plastic Surgery. Welcome to the Surgeon's Corner podcast. Our topic of discussion for this episode is rhinoplasty, otherwise commonly referred to as a nasal surgery or nose job. When patients present with complaints about their nose, their concerns fall into two main categories, those being functional or having to do with breathing, or aesthetic, having to do with the appearance of the nose. A rhinoplasty is a commonly performed surgical procedure that can simultaneously address both of these areas of concern. Within the aesthetic category, there are multiple issues that patients can present with regarding the size or shape of their nose. Common concerns include a large, wide, or deviated nose, a dorsal hump, and concerns regarding a large, misshapen, and malpositioned nasal tip. Some patients also present with complaints regarding the size, symmetry, or shape of their nostrils. Functional concerns revolve around issues pertaining to breathing, mostly related to nasal airway obstruction, be it partial or complete. Although there are certain nasal structural issues that might be involved, like a deviated septum, turbinate hypertrophy, or collapsed nasal valves, there is also the possibility that nasal airway obstruction is the result of medical conditions that are not amenable to surgical correction. Certain conditions, such as environmental allergies, for example, can cause thickening of the mucosal lining of the nose, which can restrict nasal lumen and thus reduce airflow. It is important to understand that these non-structural causes of nasal airway obstruction are not amenable to surgical correction, but rather are treated via medical modalities such as allergy medications or inhalational steroid treatments. After taking into consideration the patient's complaints and medical history, the surgeon will then evaluate the aesthetic and functional aspects of the nose by performing specific diagnostic maneuvers and taking into consideration certain parameters, contours, and proportions that contribute to an aesthetically pleasing nose. Some of these areas of clinical evaluation include the assessment of such things as nasal symmetry, shape, length, and width. It is also important to study the proportionality of one component of the nose as it pertains to another, as for example, the proportional dimensions of the nasal tip compared to the overall width of the nose. The relationship in the size and shape of the nose and chin are also extremely important in creating an aesthetically pleasing face with adequate proportions. When indicated, a rhinoplasty in combination with chin surgery or genioplasty leads to enhanced synergistic results. It is paramount during the initial consultation for the surgeon to fully understand and be able to visualize the patient's complaints regarding their nose, and for the patient and the surgeon to have a mutual, clear understanding of the aesthetic and functional goals to be achieved. It is the surgeon's responsibility to make sure that the patient's aesthetic goals are achievable within the technical limitations of the surgery. Case in point, a patient's desire to have an extremely chiseled and defined nasal tip might not be compatible with someone who has very thick, oily skin. A rhinoplasty is most commonly performed under general anesthesia in an ambulatory surgery setting. Although the operation is usually performed as a standalone procedure, it can also be combined with other synergistic surgeries such as chin manipulation or buccal fat reduction. The operation itself involves adequate exposure followed by a multitude of maneuvers that the surgeon will use to manipulate the skin, cartilage, and bone of the nose to create an aesthetically pleasing and functional result. From a perspective of technique, there are usually two approaches when it comes to exposure: the closed, otherwise known as the endonasal approach, and the open approach. In the closed approach, all incisions made are inside the nose and not visible on the skin. In the open approach, there's a small transverse incision made across the columella. This is the bridge of skin between the nasal tip and the upper lip. This incision allows for the surgeon to peel back the skin coverage of the nose in order to fully visualize the structural components that lie underneath, those being cartilage and bone. The choice in exposure technique is usually determined by the level of difficulty of the rhinoplasty being undertaken, as well as the surgeon training and preference. Once the proper exposure is achieved, the surgeon will reshape or reposition the nasal tissues in order to create the desired result. These manipulations are varied and tissue-dependent. Bone manipulation might include rasping for contouring or osteotomies, which are cuts made in the nasal bones in order to manipulate their shape and position. Cartilage can be removed, added, or strategically sutured to manipulate shape. At times, cartilage grafts are used to contour certain aspects of the nose. The cartilage used for these grafts is usually harvested from the nasal septum or from the rib. Rib cartilage harvest requires a small 1 to 2 centimeter incision in the anterior aspect of the chest. Upon completion of the surgery, most surgeons will place a small packing inside the nostrils, as well as a splint of some sort outside the nose, which is usually secured by tape. Post-rhinoplasty, it is not unusual to experience swelling and bruising for the first 1 to 2 weeks. Most of the time, the internal and external dressings is removed at 1 week. Although most patients can resume work after 1 to 2 weeks, it is not advisable to engage in strenuous physical activity or contact sports until about 6 weeks after surgery. Lastly, although most of the swelling associated with a rhinoplasty is almost all gone at about a month, there can be some residual mild swelling, particularly in the nasal tip, which can last up to 6 months or more. As with any surgical procedure, rhinoplasty has its own set of potential complications. Certain risks, such as bleeding, infection, scarring, and anesthesia-related complications, should be fully understood and taken into consideration when deciding whether or not to proceed with surgery. Patient dissatisfaction with the aesthetic or functional results is also unfortunately a potential outcome and can best be prevented when both patient and surgeon are in agreement on desirable, achievable goals. At times, surgical revision might be necessary in order to achieve unmet expectations. In conclusion, rhinoplasty is a well-tolerated surgical procedure with potentially life-altering consequences by addressing certain aesthetics and functional concerns related to the nose. When done for the proper indications by an experienced surgeon, desirable results are to be expected, leading to optimal patient satisfaction and much improved quality of life. Thank you very much for your time and attention. I'll see you in the next video.